Hey folks, I'm Ted Cantu, and I'm reporting from Dr. Hines Dental Clinic in Southfield, Michigan, and I'm joined today by Marcia.
Hi.
Hi, how are you, Marcia?
Fine.
Good to see you. And she's a dental hygienist here, and I got some really important questions for your smiles out there, Detroit, because this is a pretty serious topic, and I'm talking today about oral disease and early detection of oral disease. So, Marcia, what should we be looking for when it comes to like negative conditions of, for some early signs of oral disease?
Well, when you come into our office, we will be taking digital x-rays, and we will do an exam visually of your mouth, and we'll do all cancer screening. We'll check for dental caries and check for any gum disease. We're looking for early stages. And my job is focused on the prevention and the treatment of those early stages of gum disease.
Wow, that's a pretty important job. Now you go in there and you can actually find out when something like that can happen. What do you look for typically? What should we be on the lookout for?
We're looking for like any bleeding, any swelling, deposits of tartar on the teeth, and we take measurements to see how if there's any bone loss around the teeth, and if there is bone loss, to see how deep that bone loss is around the teeth, because it's the bone that holds the teeth in the jaw itself. Wow.
Now that's important to know. And when you look at the different patients, what different things do you take in consideration as far as like pre-existing medical conditions?
Right. We look at their current health, and we're also taking note of their current medications. We're taking blood pressure, we monitor the blood pressure, and then we, like I said, take the perioprobing. So we just do an overall view of the patient's, not only their dental health, but also their medical health.
I see, okay.
Patient as a whole.
Wow, and also too, it's important to let the dental hygienist know about any kind of prescription medications that you may be on, correct?
That's correct, because we don't want any medical contraindications or any problems with anything that we may be giving you, like the anesthesia, to react with any medications that you're taking.
That's very, very important. So make sure you let your dentist know exactly what kind of medications that you're on when you come in here. That's very, very important. And also, I have a really important thing to ask you about gum disease.
Okay.
And what are the things that you look for overall gum health?
Well, we want there to be no bleeding when you brush and floss, and that there is no plaque left on the teeth. And plaque usually is a clear film, but when it's mixed with food, it's a white substance, so you really don't want that around the teeth and gum, because that irritates the tissue and causes the bleeding. And with that we call gingivitis.
And folks, when you come into your dental office, I want you to really pay close attention to asking some really great questions about things like preventative techniques and home care products, because we have some great information right here. Marcia's going to show you some things that you need to know.
Well, if you get debris on your tongue, and like plaque, and you can't get it off with your toothbrush, you may need a tongue scraper. If you're getting food stuck in between your teeth and it just drives you wild, you may need a Proxa brush, and you just push that food right out of the middle.
That's great.
Or if you just can't get the knack of flossing with your hands and the string floss, you may need a little flosser. This is a travel size one. It's great. You can just stick it in your purse or your pocket, and you just go ahead and floss like you normally would floss.
Wow.
Get those teeth clean.
Well, that's really great. And what else do you have?
This is a pamphlet. If your mouth is dry from taking medications that dry your mouth out, there is a saliva substitute, and you just put a little bit on your tongue, running around your mouth. It keeps your mouth moist. And then, of course, the wide variety of toothpaste that are out on the market. We can help you sort out what you really need to look for when you go to the supermarket and you're looking for a new toothpaste.
Well, that's great. You know, I think it's really important that whenever I go into get my teeth worked on, I like to go into like a full service place where I can ask all the questions I want instead of, here, sit down and pay your bill and get out. You have a lot of different things you can share with people, and that's so important.
Right.
And I really appreciate that. You've got some great products here. And for people on the go, you know, we live in a very 24-hour society now with mobile technology, and no one stays in the same place very long. And you got to really keep in mind that you have to take care of your teeth because your teeth keep care of you. And you got some great products here. I like the flossing on the go thing. Is really, really important. So.
Yeah, that's great. That's my number one product that I use. And then you can also buy an electric toothbrush, and they really have improved over the years. And now the sonic brushes are just wonderful as far as keeping your teeth clean if you have a problem with the manual brush.
Wow, that's great. Is that's Oral-B?
This is Oral-B.
Okay. And can patients get that here?
You can.
Okay.
We have it available here in the office. You can also get those teeth whitened, and we have whitening kits for $99.
Wow,
That's
great.
it.
Okay. And how long does that take to do?
About the normal appointment, 1 hour.
Wow. Well, that's really cool. That's great. So if you see now, you're never too busy to take care of your teeth, and that's really, really important. We have a phone number up here that we're going to post. If you want to come in and schedule an appointment, and of course we got the website address up here as well. And Marcia, it's been really great talking to you. Thank you for having me in today.
Thank you.
Okay.
Come on in. I'm looking forward to pampering your smile.